To initiate monitoring on the Philips Monitor 6100, 6300 or 6500, ensure the patient is properly connected to the monitor. Confirm all profile, alarm limits, alarm and QRS volumes, patient category, paste status, and other relevant information is accurate. Once confirmed, monitoring can begin. Let's start by connecting electrodes to the patient to monitor the electrocardiogram, or ECG. An ECG measures the electrical activity of the heart, as well as the respiratory rate. The monitor displays the ECG waveform, heart rate numeric, and other information for the ECG. The skin is a poor conductor of electricity, so you must carefully follow the advised skin preparation steps to ensure good electrode-to-skin contact and a noise-free ECG signal. Use Philips-specified electrodes and cables of the same brand and type to help minimize noise, ensure accurate readings, and protect the monitor from damage during defibrillation. Be sure to follow the instructions for use found on the electrode packaging. Attach the clips to the electrodes before placing them. Snaps should be connected after the electrodes are placed on the patient. If you are not using pre-gelled electrodes, you must also apply electrode gel to the electrodes before placing them on the patient. This gel is necessary for establishing a good signal. Place the electrodes on the patient according to your chosen lead placement. The example here is for 5 lead placement. Then, attach the electrode cable to the patient cable. Plug the patient cable into the white ECG connector. An ECG waveform and numeric will appear on the monitor display. Now we will measure the oxygen saturation, or SpO2. The sensors and adapter cables that can be used differ depending on the purchased SpO2 option. You must connect the sensor cable to the color-coded socket on the measurement device. Closely follow the selected SpO2 sensor's instructions for use and adhere to all warnings and cautions. Remove any colored nail polish from the application site and ensure the extremity matches the sensor size so the sensor neither falls off nor applies excessive pressure. Check that the light emitter and the photodetector are directly opposite each other. All light from the emitter must pass through the patient's tissue. Avoid placing the sensor on extremities with an arterial catheter, an NBP cuff, or an intravascular venous infusion line. The pleth wave appears on the monitor screen once the monitor obtains the signal. The monitor also displays the oxygen saturation of arterial blood, or SpO2 numeric, along with the pulse rate, and signal quality indicator for fast SpO2. Finally, let's look at how to monitor non-invasive blood pressure, or NBP. The Philips monitor uses the oscillometric method to measure NBP. Oscillometric devices measure the amplitude of pressure changes, or oscillations, in the occluding cuff as the cuff deflates from above systolic pressure. As the cuff pressure decreases, the pulse breaks through, and the pulsations increase in amplitude, reach a maximum, which approximates to the mean pressure, and then diminish. To monitor oscillometric NBP, begin by connecting the blood pressure cuff to the air tubing. Plug the air tubing into the red NBP connector and check tubing for kinks to ensure air is able to pass unrestricted through the tubing. Prior to positioning the cuff around the patient's limb, ensure it is the appropriate size as the fit impacts the accuracy of the measurement. An ill-fitting or poorly positioned cuff can result in overlooked hypotension or hypertension. The marking on the cuff must match the artery location. When wrapping the cuff snugly around the patient's limb, ensure that the index edge falls within the range indicated by the range arrow. Try to apply the cuff on the limb at the same level as the heart, and ensure the tubing is not kinked or twisted to safeguard the accuracy of the measurements. Once the cuff is in place, you can measure the patient's NBP. To do so, select the Smart key. Philips